Hey guys, it's Gianna, Midwifay. Today I wanted to talk all about birth plans. What is a birth plan? Who needs a birth plan? What needs to be included? What do I often see is not included that I think should be included in a birth plan? And just really get down into all the details of what a lot of people ask about. So let's get started. Birth plan is essentially a document that families write that lays out the do's and don'ts of what they want to experience during their birth. So birth plans can range from one page to several pages long and can either be really basic or really detailed. There are several places where you can find a birth plan. There's a lot of free online birth plan templates. Some doulas, childbirth educators, have their own version of a birth plan. Sometimes your OB office or midwife office has some sort of birth plan form for you to fill out. And even sometimes hospital registration forms include some verbiage of a birth plan for you to fill out. Generally, a birth plan includes anything from who you plan to have present in the room with you, your partner, your doula, your mother, etc., to your plans for coping with labor pain, whether that be epidural, IV pain medications, no medications at all, to specific newborn cares and procedures and your preferences there. So the birth plan can cover a lot of different things. Most of the time, couples come in with these birth plans written down and they present it to their triage nurse, their labor and delivery nurse, kind of the first thing that they get in doing. A lot of nervous partners are like, here's the birth plan, here it is, and hand the paper to the hospital staff. And so let's talk about, is that really necessary to write it down? What does that do for your birth? Let me start by saying I think there's a lot of positives to having a birth plan. My number one positive is that it gives you information, okay? I am all for, and the reason I started this channel is for people to get information. When you go into pregnancy and childbirth, there's a lot of things that you don't know, or you don't know that you don't know. And so I think doing research on a lot of the common procedures and policies and things that can happen during your birth experience is really empowering. The more information you have, the less you have fear also in regards to childbirth and things that you can experience during childbirth. So I'm all for information and educating yourself to find out about the common things you may experience during your birth. The biggest, most important positive of doing this research, getting this information, is to talk about it with your provider, okay? From the beginning, as you're doing your birth plan, I want you to be talking to your provider, your OB, your midwife, your primary care doctor, whoever is caring for you during your pregnancy. Talk about these things that you're researching, okay? Start asking open-ended questions in regards to these things that you're wanting to put down on your birth plan. I think a lot of times people make the mistake of writing this elaborate birth plan, maybe bringing it in at 36, 37 weeks, sharing it with their provider, who then says, yeah, none of these things need to be written down. Also, I don't do this, I don't do that, that's not a thing. Just showing you that they are not aligned with your desires for your birth and your experience. So that would be the biggest positive, I would say, of birth plans, is empowering yourself with education and information and sharing that with your provider along the way to make sure that your plans, desires, goals align with your provider and with your facility where you plan to give birth. There is a negative side to birth plans, and the main one that stands out to me is when my patients and clients are trying to assert a sense of control over the experience. I know that pregnancy and childbirth, especially the first time you go through it, are really scary sometimes, all the unknowns, and there is this desire to want to control what you can and kind of research everything and make sure that you lay out what you do and don't want as a sense of control to help you feel like, okay, I got it, I know what's going to happen, this is on the plan, let's move forward with it. I get that. However, when you spend so much time focusing on control with your birth plan, that often leads to mismanaged expectations and experiences that aren't necessarily going to match up with the 2, 3, 4 pages of very strict rules and guidelines that you have on your birth plan. I also think another negative side of birth plans that is unfortunate but true is that often when you present a busy labor and delivery unit nurse with a birth plan, especially a multiple page long one, she's going to immediately be like, okay, yeah, these people want the birth plan. And I'm not trying to speak poorly of nurses. I was a labor nurse. I work with amazing labor nurses. I understand the demand on them and all the different things that they're required to do to care for you while you're in the hospital. So when you bring in this template that tells them what they can and can't do, how to do their job potentially, that can be really frustrating for them and kind of set the tone from the beginning of the nurse-patient relationship that might rub the nurse the wrong way. I'm not telling you that to tell you not to write a birth plan. I'm just telling you that there are some more hospital-friendly ways to write birth plans and more flexible ways to write birth plans. What I like to talk to my friends and patients and clients about is birth preferences based on scenarios, okay? So you can lay out different scenarios and preferences you might have for each of those. For instance, my induction of labor preferences scenario, my spontaneous labor preferences scenario, and my cesarean birth preferences scenario. Again, I recommend really starting to talk and think about these things around 24, 28 weeks of pregnancy, because by then there's been some different ultrasounds and testing done that can alert you and your OB team if there's any risks for you and baby that we're going to need to follow, such as placenta abnormalities or diabetes or high blood pressure pregnancy, that may inform your plan. So as your pregnancy progresses, you can continually update these birth preferences and write on them, the things that you discuss with your provider, and checking in with the facility where you plan to give birth to see what their policies are, say on continuous monitoring, on eating, drinking, and labor, on IV status, instead of writing these things down. If these are common policies that are hard nose at your facility, do you even need to write them down? Do you need to choose a different facility? So I think having these preferences written down so that you can discuss with your team and fine tune them as your pregnancy goes along. As I talk about writing up birth preferences for several different labor scenarios, I want to have a shameless plug here for doulas. Shout out to all the doulas out there. Thank you for what you do. A lot of times doulas work on these with you throughout your pregnancy. During the visits that you do with them while you're pregnant, they go through your preferences and they often educate you on different types of births and how things might be different. Seasoned doulas who've been around and know the facilities in your area know the different policies of the different hospitals, sometimes even know the different providers and practices, and know what different things you can ask for and which ones aren't necessarily realistic in your specific birthing scenario. So again, doulas would be very helpful in forming your birth plan for you and your partner, and going through the different preferences you have for birth. When it comes to the day, the doula can also be the person that's there to advocate for you and assert those desires for you. Your partner often wants to have that role, and that's fine, but you want your partner to be experiencing the birth of their child as well and being able to support you and emotionally go through whatever they need to go through. So I think having the doula who's the one there to say, hey, this was in your plan, this was in their plan, and just kind of be that liaison between you and the staff, I think is hugely helpful. So get a doula, go work on your birth plan with your doula. I think that sounds like a great idea. Some things I find commonly left out of the birth plan are really thought out newborn cares procedures plans. So kind of your knowledge of what happens once a baby is born. What are the different procedures that we do and offer in a hospital? Which medications do we offer? I think a lot of people kind of stop their research there and don't necessarily know what to expect after that first hour, the golden hour, skin to skin, delayed cord clamping. I think a lot of people know that, but in the 2-3 days that you're in the hospital with your baby, what different procedures do we offer? Again, what different medications do we offer and recommend? And so really being able to talk about those preferences and maybe even discuss them with your pediatrician if you can beforehand. Another part of newborn cares is the feeding plan. Whether you plan to breastfeed, whether you plan to formula feed, whether the baby needs some other form of support nutritionally vaginally or through IVs. You know, again, not that you anticipate any of this happening, but doing a little bit of research and being able to write out your preferences for what you would want for your baby in those scenarios. The last thing that I know is left out of a lot of birth plans, and this is going to be a whole other video or a series of videos on its own, is your postpartum care plan. How are we going to care for you and your postpartum body, mind, and spirit now that you've birthed your baby and you're transitioning to being a mom? Now let me step back and say, I do not think you should put this on the birth plan that you give to the hospital, because that's going to for sure make it many pages long. But I just mean to say that we make a point to prepare so much for the birth and get all of the stuff for the baby and make sure all that's perfect, but we don't make a plan, a care plan for ourselves. How are we going to take care of ourselves? How are we going to take care of ourselves as a couple as we're welcoming this new life into the world and into our home? Again, many doulas are really good at this, at helping you identify what needs you and your partner have for this family, for this baby joining your family right now, and what that might look like. And they encourage you to sit down and take the time to come up with a game plan for your immediate postpartum period, that first 4, 6, 8 weeks postpartum, when you're really, you know, in the trenches and doing what you need to do to keep you and baby alive and well. So I hope this discussion about birth plans was really helpful. Overall, I think it's a really empowering experience to do research, gather information, and mainly to talk through these things with your provider before you plan to give birth. Make sure you review what different preferences, desires, goals you have for your birth experience, and ask them which ones are possible at the facility when you plan on giving birth. If you find that you keep button heads with your provider or with the facility, and that a lot of the things that you want for your birth aren't going to be able to happen, I encourage you to look for a different provider, look for a different facility. Start these conversations early so that you can feel empowered and educated, but also so that you can really kind of pave the way for the type of birth you want to have. I also want to encourage you, as you're doing your research, to remember that this is not about control. Childbirth is practice for parenthood, which is forever, and we cannot control anything really, right? There's a few things we can control, and there's a lot of information we can gather to do our best to make the best decisions that we can at that time. But when we try to focus on control, often things go in the opposite direction that we would want to. So I just encourage, as you're doing your research, writing your birth preferences, that you make sure that you're not trying to focus on control. Lastly, I just want to share this quote from one of my favorite childbirth prep and pregnancy books called Birthing from Within. This quote really, to me, just very perfectly says that when a person is pregnant, she needs to plan on surrendering to the process, on staying as healthy and well as she can for herself and her baby, mentally, spiritually, physically, and really focus on the positive things that help her do that. Not focus on all the negative things that will get in the way of that. So I just want you to think about this quote as you're moving forward with your pregnancy and planning for your birth experience and possibly writing your own birth plan. All right, I hope this discussion on birth plans was really helpful. Please comment down below if you want to talk more about this. Share this with another mama-to-be so that she can start planning for her birth experience. All right, I'll see you next time. Bye, guys.